Next on Sisterhood of the Second Act. According to the Centers for Disease Control and Prevention in the United States, 1 in 5 women between the ages of 55 and 75 will have a stroke. Family nurse practitioner Jamie Brackenrich with Lewis Gale Physicians is here to talk about stroke prevention in women and how to recognize the sometimes subtle signs that point to you being susceptible to a stroke. Physician's assistant Sue Hill is the integrative medicine practitioner at AgenaCare, and she's here today to share some natural methods that women can employ to ease the symptoms of menopause. We'll meet these women on this edition of Sisterhood of the Second Act right after this.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
See where a grateful nation remembers its heroes, and where Thomas Jefferson came to relax. Where small town charm is just down the road from big outdoor adventures. Find peace and quiet, as well as the sounds of family fun. Destination Bedford is located where the Piedmont Plateau meets the Blue Ridge Mountains of Virginia. Where ordinary ends, Bedford begins.
Now from the Fox Radio Roanoke studios, this is Sisterhood of the Second Act. Welcome to Sisterhood of the Second Act. I'm Denise Allen Membrano. According to the American Stroke Association, stroke is the third leading cause of death in women and kills more women than men. In fact, 1 in 5 women will have a stroke. Family nurse practitioner Jamie Brackenrich works in neurology at Lewis Gale Physicians, and she's here to tell us what we need to know about stroke and why some women are susceptible. Jamie, thank you so much for being with us today.
Absolutely.
We appreciate it. What is a stroke? First of all, some people may not understand what is a stroke and what are the different types.
So we've heard heart attack, and I'm not sure why we don't call it a brain attack because it's very similar in how, so a stroke is basically there's a blockage in the blood flow to the brain. There's tissue death because of that blockage, and so part of the tissue of the brain does die. So there's 2 types of stroke. There's ischemia, and that's a blockage. And then there's one where if the vessel of the brain becomes weakened, it can rupture, causing a hemorrhagic stroke.
So what puts women at risk of a stroke?
It's kind of what puts anyone at risk. High blood pressure, high cholesterol, unhealthy lifestyles, high salt intake, sodium intake. What puts women more at risk for stroke than men is, we're more at risk for high blood pressure. I think women tend to put our health on the back burner in some ways. We take care of the family, we're doing all these other things, and we kind of put our health aside. And so those things kind of are happening underneath the surface. We're not aware of them. The blood pressure is elevated for a period of time. So that puts women especially more at risk for stroke.
When I was doing research for this article, for this interview, I saw that African American women experience more strokes, and even Latino women. What is the difference there?
Yeah, I think I saw research. You'll see different numbers in different resources, but I think it was like 1 in 4 or 1 in 5 African American women have stroke, tendency for stroke, and I think that's because they're more at risk for things like high blood pressure. Their diets are sometimes higher in salt. And then just genetics. Some things are just you're genetically predisposed for, so like clotting disorders, sickle cell disease. Sometimes we just can't fight our genetics, and it's just something that's there. We need to identify it so that we know how to treat it.
Okay. So we are talking with family nurse practitioner Jamie Brackenrich. She's with the neurology at Lewis Gale Physicians. And do strokes present differently in women than in men?
I would say, again, similar to heart attacks. With heart attacks, we've heard women have, back pain or they're nauseous. It's not typical clutch your chest heart attack. Similar with a stroke in that I think women have these underlying conditions, migraines, chronic fatigue, anxiety, depression. And so sometimes they have symptoms, they're tireder than usual, they're just weak all over. We'll talk later probably about the classic symptoms of a stroke. And so sometimes these things can just be vague. I have a headache, but I have a history of migraines. And so that they put them off until it's really bad and noticeable. And at that point, it's too late to treat the stroke.
So what are those symptoms of a stroke?
So we use the acronym FAST for just public education, and FAST. So F stands for facial droop, and so you have the patient smile, look for asymmetry in the face. A stands for asymmetry of the arm droops if you were to have the patient put their arms out. One side is weaker than the other. And then S is for speech, slurred speech, sometimes even just difficulty getting your words out can make us think it's a stroke. And then T is for time, so you want to get to the hospital as soon as possible, call 911 if any of those symptoms present. The atypical symptoms, which sometimes for women could include dizziness. People with vertigo often go untreated because they think it's just a vertigo attack, but it's really a stroke.
Wow.
Loss of vision is another one. Sometimes patients come in and they say, I had no idea that because I had blurred vision in one eye that could have been a stroke. Because we teach the FAST that sometimes these other things go unnoticed.
Wow, I didn't know about the blurred vision either.
Yeah.
So we said earlier in the introduction that more women will die than men. Is that because of those earlier reasons, or is there genetic differences between the sexes?
I think from what I've researched, it's more that women live longer than men. And so the older you are when you have the stroke, the less likely you are to recover. And so women live longer, they're having strokes later in life. So therefore the number is higher as to how many strokes.
Okay.
And then that also, it makes statistics show that women don't recover as well as men because we are in that older age bracket. So it's harder for the brain to recover. So the older population is left with more disability than a younger person.
Okay. We are talking with family nurse practitioner Jamie Brackenrich. She's from Lewis Gale. She's in the neurology department there. And are there any tests for stroke?
So your provider, your family doctor, usually has various testing that they'll do annually, different questions they take into consideration, your sex, your background, your family history. There are certain scoring tests, I guess, that you could use that would let the provider know if you do need to be on certain medications to control blood pressure or certain medications to thin your blood. If you have a family history of these things, identifying what it is and being able to treat that with medication or other therapies. So there's not one specific test for stroke risk. It's kind of a general assessment and clinical evaluation.
You mentioned that blurriness in one eye. If someone doesn't realize that they've had a stroke or what they call a mini stroke, what if it goes untreated?
So they say time is brain, and so they want you to get to the ER as fast as possible because if you are within a window of time after the stroke symptoms present, you're eligible for what we call a clot-busting medicine. And so they can administer that if you're a candidate in the hospital while you're monitored, and sometimes that will break the clot if it's ischemia, which is a blockage. So your brain is not getting blood. You want to get that blood clotting medicine in fast. And so time is of the essence. Brain is time. Time is brain. So if you were to stay home, sleep it off, think you'll wake up in the morning and feel better, at that point it would be untreatable.
Wow.
At that point we would talk about, okay, where did this come from? Can we identify a source? And how do we prevent you from having another one? But at that point, you're going to have a long road of recovery ahead.
And I guess that recovery is like physical therapy or occupational therapy, depending on
Right.
what,
Speech therapy.
what part of the brain it
Yeah.
killed,
Right.
for lack of a better
The
word.
brain is good at recovering. It does, we tend to give our patients like 6 to 8 months time to recover. And in that time, you'll see some improvement. Some people recover completely. It's really dependent on the patient. But yeah.
So what can we do to prevent this from occurring in the first place?
So I would say being in touch with your family doctor, making sure that you're having these annual tests, checking your cholesterol, making sure your blood pressure is monitored and in a good level. These other chronic conditions, making sure that they're well treated and that you're getting the attention that you need. And then the things that we all know to do but just struggle to do is heart-healthy diet. I can't say that enough, and exercise. We're all tend to be active, just we have active jobs, we have active families, but we need to do a little bit more physical activity to get our heart rate up, to make it stronger, to bring our cholesterol down, to lose some weight. All of those things will keep you. They're modifiable risk factors: obesity, high blood pressure, high cholesterol. They're things we can change. And so we have to do our part in taking care of our bodies.
And taking care of being healthier also, should you do have one of those strokes that it might be hereditary, it gives you more room to recover.
Exactly. Right.
Jamie, thank you so much for the information today. We really appreciate it.
Sure, absolutely.
And we will have Jamie's contact information in today's show notes at sisterhoodofthesecond.com. And when we come back, are you overheating, having trouble sleeping, and maybe experiencing mood swings? Natural ways of navigating the symptoms of menopause right after this.
In a region known for its beautiful mountain surroundings, our vibrant arts community makes the Allegheny Highlands a more colorful place to live and visit. Our passion for the arts is endless, and it's uniquely Allegheny.
Pat Lucas is committed to providing independent financial advice to individuals, families, and small businesses. Contact Pat at 540-798-8104. 540-798-8104. Securities and investment advisory services are offered solely through Equity Services Incorporated, member FINRA SIPC, 4401 Starkey Road, Roanoke, Virginia 24018, 540-989-4600. Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with a loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Once again from the Fox Radio Roanoke Studios, Sisterhood of the Second Act. Welcome back to Sisterhood of the Second Act. I'm Denise Allen Membrano. Menopause is a natural stage in life. It's not an ailment, but it can have some life-altering symptoms. There are prescriptions to help mitigate hot flashes, loss of hormones, and even fatigue. But there are also natural ways to help navigate these symptoms. Physician's assistant Sue Hill is the integrative medicine practitioner at AgenaCare. She's here to tell us about natural ways to help make this life transition easier. And Sue, thank you so much for joining us today.
Thanks, it's a pleasure to be here. Thank you for having me.
I know a lot of people want to hear more about this. So what are some signs that a woman may be going into menopause?
It's initially a gradual process, and there's actually 3 phases, if you will, of menopause. There's perimenopause, menopause itself, and then postmenopause. So the signs that women will typically see in perimenopause are a gradual onset of irregular menstrual cycles, temperature fluctuations, the famous hot flashes, or night sweats, low libido, sleep disturbances because of some of those night sweats, changes in mood, irritability, mood swings, anxiety, depression, weight gain, of course, that's the other one that is a challenge, thinning hair, dry skin, some breast changes, urinary urgency, so all kinds of things. I jokingly call it reverse puberty. So, unfortunately, it was tough the first time. It's even tougher the second.
So we've all heard the stories about horrible hot flashes and the mood swings you mentioned. What causes these things to happen?
So the culprits are the slow production of estrogen and progesterone, and that's just a result of the diminished ovarian function. And this is, again, the phase known as perimenopause. So, but typically the primary culprit is the decrease in estrogen. And this is typically responsible for the hot flashes that occur from the decrease in estrogen levels. So your glands release higher amounts of other hormones that affect the brain's thermostat, if you will, and that's what causes those hot flashes. So it's the body trying to figure out and equilibrate when there's a lack of estrogen. So that affects the thermostat in the body.
So are there things that we might be doing in our everyday lives, like our diet or anything that might make these symptoms worse?
I wouldn't say worse, but they're not helping. They're not helping to mitigate the symptoms. So obviously the top of the list would be a poor diet and lack of exercise. So as the body and its hormones change, your lifestyle and lifestyle choices also have to change along with that. So we address proper nutrition, recommend a whole food diet. So if you're doing drive-through, that probably needs to be changed. Then the whole food diet, which is full of fruits, vegetables, whole grains, legumes. So if that's not in your diet during the perimenopausal phase, then that's not really helping you. So you need to think about changing that. The other things that will increase these symptoms, of course, are alcohol or spicy foods and caffeine, smoking, and being overweight. And so that's where the lack of exercise and lack of activity comes in.
Spicy foods. I've never heard that before. What is spicy foods?
Spicy foods like hot Thai or foods or hot Mexican foods, or very, very, and they affect that thermostat.
Oh,
so
okay.
They trigger that. So.
Wow. We are talking with Sue Hill. She's the integrative medicine practitioner at Agenacare, and we're talking about natural ways to navigate menopause. We mentioned integrative medicine. Give us a little history. What is integrative medicine?
Integrative medicine is an amazing little subsection of medicine that's really gaining in popularity for a number of reasons. But integrative medicine really emphasizes dietary and lifestyle behavior, and we support, in this particular case, hormonal balance and to help prevent age-related diseases. But further than that, integrative medicine really allows the patient to have individualized care based on their specific needs and their specific deficiencies or what they want from their quality of life. It's not a cookie cutter type of fix for what they're going through. So we really dial down on each person's labs and their values and lab values and their lifestyles, stressors, where they are in their life. All those things are integrated into how we take care of them. So again, it's a very personalized approach.
Now, you mentioned earlier how diet can impact some of the symptoms of menopause. Earlier, we talked about stroke. Earlier in this broadcast, we talked about stroke.
Right.
So all of these changes you're talking about tie into that as well.
Right.
So what are some other natural ways that we can tackle some of these symptoms?
Right. So the first thing I would say is lead less, a sedentary life will really sort of exacerbate these symptoms. So I would say get up, move, take walks, go for a bike ride. All those things will help mitigate the symptoms. Again, I'll go back to the proper nutrition, because food is basically an excellent way. It's a medicine in and of itself, if you will. So we really encourage you to pursue that whole food diet.
We don't consider in this country food.
No, isn't that a shame? Right. Yeah, and you're absolutely right about that, and we should, because it's an excellent resource that we just need to promote more. So that's what we're here to do with that. In the food category, lean proteins, they help increase the hormones break down proteins during this phase. So if you eat more protein, that's going to help prevent the weight gain and the muscle loss that's inevitable. So you're helping supplement the loss of protein because of the loss of the hormones that support that. Omega-3 fatty acids like flax seeds and fish oil, that's also a part of the diet that will help with you. And some herbal medications that we also look to are like black cohosh, that helps with the hot flashes, night sweats, and some of the psychological symptoms that we see. St. John's wort is a good alternative to SSRIs. There are some things that we need to be careful about with St. John's wort. If you're on medications for your heart, for instance, that are prescriptions for your heart, if you're on blood thinners, that's something we need to really be careful about. Maca root is another one that's an adaptogenic herb, and that just helps the body adapt to stress. Vitamin D, calcium, folates, acupuncture is surprisingly really good for vasomotor symptoms, going back to helping with the hot flashes and types of things like that. I am a huge fan of aromatherapy. I think that it works amazingly well, and it's a subtle method to sort of calm one down. You just, have your aromatherapy going when you get home from work or whatever. And massage and yoga, which again is another the form of just stretching and moving the body. So those are all alternatives that can help mitigate the symptoms of perimenopause and menopause.
Are there benefits to natural remedies over the synthetic prescriptions that women may get?
There are. I think that that the natural benefits are that they're easily accessible to you. For instance, you can easily alter your lifestyle as far as it's sedentary. You can start walking, or you can change your diet easily. You don't necessarily have to go to a physician for all of those things. You don't need a prescription. You don't need to spend money on pills and things like that. So that's obviously the first benefit of natural remedies, and it's a lot gentler and kinder on your body. So I think that that's paramount, because I think a gentler, kinder approach is
something we all
better.
need.
Yeah, we all need. It's definitely better, personally, I think.
And we are talking with Sue Hill. She's the integrative medicine practitioner at Agenacare about natural ways of helping with menopause. So natural doesn't mean no side effects.
That's right.
So what do we need to be? You mentioned earlier some, like if you're taking certain medicines, St. John's worts might be an indicator. So we should talk to our doctors before doing these.
Yes, and it's imperative that all the practitioners that you see work together and collaboratively. At least they know that you're seeing an integrative medicine doctor, or the integrative medicine person knows that you're seeing a cardiologist, for instance, or a pulmonologist, for instance, so that we can be careful about the medications that are prescriptions versus maybe some of the herbal supplements that are also happening. For the most part, some of the herbal supplements aren't to a great effect detrimental, but there are some out there. So especially if you're on blood thinners, heart medications, as I mentioned, warfarin, Coumadin, digoxin, things like that. So again, you have to be an advocate for yourself and
honest with the people you're dealing with.
Correct. Yeah, and be thoughtful. But again, that's where individualized approach comes in. It's so important.
So if someone wants to seek out a more natural avenue of dealing with menopause, how do they choose a practitioner?
Excellent question. So first and foremost, ask friends and family, because this is a community that has an excellent resource. So just asking around and knowing who's in your community is one thing. And then certainly evaluate practitioners' credentials, their education, training, licensing, that type of thing. And if they are willing to work collaboratively with your other conventional healthcare providers, like we were talking about earlier, so that they don't really, poo-poo us or integrative medicine and vice versa. It's very important to honor everybody's specialty. And then you want to make sure that the practitioner you seek out has experience in your health concern, if it's perimenopause or if it's a rheumatology kind of issue or if it's a GI issue. You want to make sure that they have had experience with those things. And one thing that's really important that people really need to remember in the back of their mind is don't always assume that your health insurance will cover integrative practitioners services. Not yet. Anyway, bits and pieces of it. But so that's an important part of the puzzle as well.
Well, we need to lobby our insurance companies.
Yes, we do.
Sue, thank you so much for sharing this with us today. We appreciate it.
It's my pleasure anytime. Thank you.
And we will have Sue's contact information in today's show notes at sisterhoodofthesecond-act.com. We'll be back to wrap up the show right after this.
In a region known for its beautiful mountain surroundings, our vibrant arts community makes the Allegheny Highlands a more colorful place to live and visit. Our passion for the arts is endless, and it's uniquely Allegheny.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
See where a grateful nation remembers its heroes, and where Thomas Jefferson came to relax. Where small town charm is just down the road from big outdoor adventures. Find peace and quiet, as well as the sounds of family fun. Destination Bedford is located where the Piedmont Plateau meets the Blue Ridge Mountains of Virginia. Where ordinary ends, Bedford begins.
I would like to thank Jamie Brackenrich and Sue Hill for joining us today. Head to our website at sisterhoodofthesecond-act.com for more information about stroke prevention, as well as finding natural methods for tackling the symptoms of menopause. I'm Denise Allen Membranio. We'll see you next week on another edition of Sisterhood of the Second Act.